Guess my able partner over here is too much into private practice, and I really want to ask him, when was the last time you did gonioscopy? Probably when you were a first year resident, when we were still learning. I think that was about 10, 12 years back. So frankly, for all practical purposes, whatever patient that he can diagnose with his limited amount of knowledge of gonioscopy is, he refers to me and I decide. So everything that you heard over here was all scientific data. Is one of those delegates who comes and speaks what is scientifically correct, goes back and does what I'm going to show you. So this is the scenario we're all aware of. And my thoughts are, first, cure the problem, not just treat the problem. So do a laser PI first if you see a case with occludable angles, and then go ahead with cataract surgery later on. So the case in question over here is a PAC, not a PACS or a PACG. So that itself negates all the studies that he's quoted without any basic understanding of what he was searching for. And then again, even if the IOP was just 22, it probably could be higher at other points in time, which we haven't established. And whether the cataract was visually significant or not is not known again. And like I said, gonioscopy could be worse than just occludable angles. The patient could have PAS, etc. Now, first things first, would he have dilated such a patient? He always sends those patients to me for approval, and I say no. So the risk of dilating a patient with shallow angle is also there, although it's very minimal, but it is there. If you want to take a signed consent from the patient, please go ahead and do it. Now, occludable angles are patients who can have eyes with short axial length, which itself becomes a high-risk case for surgery, and the patient could be non-ophthalmic. Also, lens instability is known to cause shallow angles in many patients, which itself can fall into problems with cataract surgery. And the chance of PACS developing into PACG is also close to 30%, so you need to address this problem. Any which way, if we still decide to go ahead with cataract surgery in these patients, this is what your post-op will look like. And so there can be many problems. I'm going to run through all of this and show you one of his videos. This is a surgery performed by Dr. Aditya Sethi. Probably did not come through because he didn't recognize that there was a shallow anterior chamber. He thought he was better than that. So now this surgery is going to go on and on and on because this is how it went. So this was a patient with an extremely shallow anterior chamber. My brave friend kept going on and on. It's very long. Believe me, it's very long. Yeah. So anyway, 2 minutes have passed of the forwarded video. The case has still not started. The first pinch in the rexus itself has still not come. He's trying, he's still trying. I think my time will go up. My time will be up. My time is up. Oh my God. See, that's how long this surgery went on. Any which way. So he's still trying, by the way. And this is a fast forwarded video. It's not even funny. And then this is I'm sorry, this is what the post-op result was. Although the surgery, he's a very good, so he's a very good cataract surgeon, but then this is how cosmetically the patient looked like. So these are all of his cases. So this is again a shallow anterior chamber wherein the iris had multiple sutures. These are the problems you can have. You can have decimate membrane detachment because of crowding of the anterior chamber. You can have corneal wounds because of that. One very potential complication which he could be unaware of because of his lack of knowledge of glaucoma is malignant glaucoma. And this is a serious complication wherein the patient has to go in for vitrectomy, etc. But anyway, I'm a boy. How can I go wrong? How can it be my fault? So he's always blaming it either on the the assistant was not attentive, or the AC was not working, or things like these go wrong in his OT more often than he does. So now my question over here is that is the risk of doing PI high? No. But is the risk of doing a cataract surgery high? Is the risk of not doing cataract surgery high? No. I don't know if the patient even asked for a cataract surgery. Probably he's the one who advised for the surgery in the first place. And also advising surgery doesn't really ensure that the patient is going to go through with the surgery. So if they don't, then there's a very high chance of a PAC patient turning into a PACG in due course of time. And what is the risk of doing is the risk of doing cataract surgery high in this patient? Yes. And so is the risk of not doing a PI in this patient. So the literature that he quoted really doesn't apply to our study, and everything that he or I know a little about glaucoma and cataract has been by our mentor, Dr. Ronnie George, and he also himself feels that the PI should be done before the cataract surgery. But anyway, this is who your doctor is. Look at me, I'm still cool, no matter what I do. And any which way, I have a lovely family, and thank you to them for all the support and the love. I still love you.
Anybody has Johnny Depp's lawyer's number?
तेरे को स्माइल चाहिए?
Multiple times through Dr. Saheeban's presentation, I looked at the sky and says, "Eh Khuda, bas kar."
You weren't alone. And I was talking to Khuda here.
नहीं तेरी खुद गई.
Dr. Saheeban, humor me. In the initial part of your presentation, didn't you say that whenever he finds a shallow anterior tumor, he does send the patients to me for approval?
Yeah.
So if he took those patients up for surgery and then struggled,
Probably
it was
those
with your
were-
approval?
Those were the patients that he didn't even realize had shallow angles. He just saw the cataract. That's why I said doctors who are too much into private practice, they only see cataract and
He
thinking
just see
money.
the center of the cornea.
I think
Yeah, just to the center.
looking at Dr. Aditya,
Why even look at the patient? Huh? This goes straight to the OT. No, in my defense, rebuttal, I've never seen these guys before. I don't know who they are. I don't know who that surgeon was. I don't know what was
you
shaking.
have not searched
So you
properly
should
on
do
YouTube.
gonioscopy to her,
Yeah, definitely.
just to find out.
The reason why I've not seen those eyes before is because you've not searched properly on YouTube.
Because anything that goes wrong is not his responsibility. It's probably somebody else's case altogether. That's what his answer is.
That's why we have friends and lawyers.
Your rebuttal
To what? I'm
Sahiba?
sorry. What was the
to
question?
whatever you wish. Dolphins swimming in the sea.
Okay. Yeah. I think when you have specialists in the house, leave it on to them. That's the better way of treating the patient in the fair interest of the patient. And also, there are no shortcuts in life, my friend.
That's why the good cataract surgeries that I've done. Straight specialist, nice.
Panelists,
Thank you.
quick comments. Stay back, both of you.
I think this time I'll go with the lady.
Thank you.
I think Adit is very lucky to have a female wife who is doing work of counseling on. Female wife.
I was lucky at female.
Female wife who she is ophthalmologist
You're
and
very lucky.
lucky to have
Anybody else
a
in
wife.
the house
She
who's
knows
had
gonioscopy. He is lucky to have a wife. She knows gonioscopy and a point to convince that this cataract need to be treated and better to get surgery done rather than doing PI. That is the important point. She agrees to it that the PI is not required if you do cataract surgery. So whenever patient is not ready for cataract surgery, he refers the go to glaucoma specialist. So either she will do PI and then say after 2 months we will do cataract surgery. So the patient understands that get a cataract surgery done.
Dr. Kelka.
That is the reason you are referring her, na? Agree.
But you're being very sweet to go with the minority. Thank you for supporting my husband.
Yeah, again a mesmerizing performance by the wife, just like always. I'm sure at home also. And yes, she put 2 points across that if it's a occludable angle, YAG PI makes your life easier. And yes, was the cataract operable? Did the patient need a surgery in the first place? Also is an important point.
So cataract was NS2, so it is affecting vision. There was no question. The pressure was 22. Just by medicines it can be controlled. And we are not thinking that not doing cataract surgery in time will definitely cause glaucoma loss. So I think scientifically he is correct. But definitely she has given more humor. So we should be with her for humor part.
Yeah, it was. Yeah, we got your point. It was a mesmerizing performance by the wife, is what you say. What I say, it was actually a pasteurizing performance by the wife. She virtually pasteurized her husband, boiled and then cooled.
Now you know why I didn't see this. Why I was
Because
not
of the
allowed
ghee.
to see the slides.
Because it ended with
Because of ghee.
It ended with I still love you. There was a still.
Still. Or S was heard by you.
Thank
it
you
was
so
still.
much, as the Sethis.
Thank you.
As we